Hello everyone, welcome back to our channel. We are here today to give our personal and honest answers to the most common questions people ask about autism. Whether you have autism yourself, or are caring for someone who has autism, or if you are just here to learn, thank you for opening your mind and your heart. Autism is often misunderstood, and we are here to help people understand. Question number 1. What is autism? Autism, or Autism Spectrum Disorder, ASD, is a developmental condition that affects a person's way of communicating, thinking, interacting socially, and the way a person perceives and experiences the world. It can affect how someone processes emotions and how they react to sensory information. This makes a person with autism extra sensitive to a lot of different things. Some days it's challenging, other days it's a strength. Question number 2. What causes autism? Currently, the cause of autism is still unknown. We really want an answer to this critical question. If we knew the cause, we would have done anything and given everything just to change the outcome for our little ones. Autism touches millions of lives. Supporting research isn't just for those directly affected. It's something we all can do to build a more compassionate, informed, and prepared world. Question number 3. Why do people with autism do awkward things? Whenever a person with autism does odd things, like avoiding eye contact, repeating movement or gestures, when they make annoying sounds, or react strongly to light, sound, or texture, these actions are not bad or wrong. To the person asking this, thank you for asking. It's okay to wonder. The truth is, it could possibly be a form of communication or a way of regulation. Because their brain experiences the world differently, what may seem unusual to you is their way of coping, communicating, or possibly how they feel safe and secure. We hope that in understanding this, people will shift their thoughts from judgment to compassion. Question number 4. Can autistic people understand emotions, or do they have feelings? The answer is a resounding yes. We see it in their eyes and on how their body reacts to the energy around them. When people around them are upset, or there is conflict or raised voices in the room, people with autism tense their bodies, or they burst out crying. But when people are being kind and gentle, and the house is filled with love, they soften their bodies, they relax, and they flourish. They may not say it out loud, but they feel everything, even more deeply and intensely. Their environment, what is around them, and what we model to them matters greatly. Therefore, it is important to maintain a peaceful and nourishing environment for people with autism. Question number 5. Can someone grow out of autism? There are people with an autism diagnosis that comes to a point when their symptoms are improved and they no longer fit the clinical definition of having autism. However, this does not mean that autism is cured or gone. Autism is a lifelong condition. People with autism just learn how to manage or compensate for their symptoms, that they become less noticeable over time. Ongoing support and reassessment are important because needs and abilities may change over time. Question number 6. Why does a person with autism hurt himself or others? Stereotyping people with autism as violent or self-harming is inaccurate. Most are kind, peaceful, and just trying to navigate a world that doesn't understand them. In our situation, we have an experience with hitting on the forehead and head batting. This is due to the need for sensory input or sensory stimulation. We noticed that ever since a baby, the need for deep pressure on the forehead has always been there for our child. As he grew older, the need for this input increased. And when he experiences intense feelings like stress, anxiety, or fear, the emotional overload leads to self-injury or aggressive behavior as a coping mechanism. It is important to know that they are not doing it to be bad. We are currently still struggling on how we can manage this better for our child. If you have any recommendations, or if you have gone through the same situation, we would deeply appreciate any advice you can share with us. Question number 7. How is autism diagnosed? Our diagnosis for autism came in differently for each individual, but they first started with a comprehensive evaluation done by our pediatrician during wellness visits. We, as parents, were given questions to answer about the development of our children. Then we were referred to specialists, like a neurologist, psychologist, speech-language pathologist, and a developmental pediatrician. These specialists gathered detailed information from us about our children's development and behavior. Then we used different standardized diagnostic tools like the Autism Diagnostic Observation Schedule, or ADOIS, Autism Diagnostic Interview, or ADIR, and the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. Other tests we got done were hearing test, vision test, genetic test, and 24-hour EEG. These tests are done to rule out physiologic factors or other underlying causes of their behaviors. Honestly, during all these testing, we didn't really feel like any of them clearly defined the diagnosis. It is not like a test for flu or COVID where you would test positive or negative and is very definitive. The tests we went through were all like an evaluation and an observation. We have a lot of reflections about diagnosing autism as a stage in our life. We think it is something important to share with you, and we will make a video covering our journey about getting a diagnosis, and we will discuss it in more detail. Question number 8. What are the signs and symptoms of autism? There are quite a number of signs and symptoms of autism, but autism isn't a one-size-fits-all. Just because someone has autism doesn't mean they will all have the symptoms you've heard about. Each person is unique, and this is exactly why we refer to it as a spectrum. We will provide you with a list of websites where you can read about the signs of autism in the description box. But for us, what we have noticed as signs that our children have autism are lack of or avoiding eye contact, limited or no response to name, delayed speech or language development, repetitive movement, spinning in particular, intense interest in specific objects, vehicles or anything with wheels in our case, and the need for a consistent routine and difficulty adapting to changes. Question number 9. What help can you provide to someone with autism? If you're a parent and you believe your child has autism, the best way to help your child is to first accept them fully and lovingly for who they are. Acceptance isn't giving up. It is seeing their worth, their uniqueness, and their potential. From there, seek a diagnosis, not to label them, but to understand them better. With the right support, you can advocate for what your child needs to thrive. Love first, then empower. There are a variety of help you can get if you have a diagnosis for autism. For our children, we have them in applied behavioral analysis, ABA, occupational therapy, music therapy, and speech therapy. For younger children, there are early intervention programs, specialized educational programs, and accommodations in school. For teens and adults, there are support groups, coaching and life skills training, job trainings, employment support, and networking opportunities. There is also guidance and support for finding housing and independent living or community living for adults. Question number 10. How can I help a family member or a friend who is caring for someone with autism? Learn. You can support a person caring for someone with autism or a parent caring for a child with autism by learning about autism yourself. We have a list of books and some resources about autism in the description box. Lending a hand doesn't require grand gestures. You can just be kind and patient to them. Learn for better understanding. Listen. Listen to their stories, and you will truly understand autism. Their journeys are filled with challenges, yes, but also strength, growth, and unconditional love. Lend a listening ear, and you can become part of the support they need. Presence. Be present for them, or at times be flexible with plans. It is one of the kindest things you can do. Plans change, and things might not go as expected. But your patience, understanding, and flexibility can ease so much stress. Pray. Pray for their strength when they're tired. Pray for peace in the chaos. Pray for hope during hard days. Pray for moments of joy, for calm in the storm, and for the right people to walk beside them and give support. Your prayers, though it doesn't change the path, can help carry the ones walking it. If you have more questions about autism, please, we encourage you to leave them in the comments, and we will try to answer them the best we can. This platform is dedicated to give light to our unique journey and bring support to our community. Thanks for watching, and we will see you on our next video.